Are you okay with anecdotal evidence or stories?
I mean, I
I mean,
always take them.
would you be
I
willing
always
to
take them with.
listen to mine?
Yeah, I mean, yeah, I always take them with a
Okay.
massive grain of salt. But yeah, if you
Okay,
want
yeah.
to.
So take this with a massive grain of salt. But this is a real anecdotal experience that I personally had through my son. He's in drama. He's a great thespian. And he started in his freshman year. Now he's a senior. And in his freshman year, I would go to a bunch of shows and stuff. And he came home and he told me, Dad, 14 people within the drama club, and I think there's about 40 in total, were either non-binary or trans. I said, okay.
How
And I
many?
said, yeah, 14 out of 40.
In the
And
drama
yeah,
club.
in the drama program. Okay. Fast forward to his senior year, all those 14, every single one of them is no longer trans or non-binary. Now, if there would have been, let's say, a trans activist within his school kind of pushing those freshmen to either transition or, continue on that path instead of just leaving them alone, it could have ended up that one of the 13, two of the 13 would have done something they regretted. This is a real anecdotal story. And this is why parents across the United States are very concerned. The bottom line is that I do think social contagion is a real thing. I do think that kids are very susceptible to adult peer pressure along with student peer pressure. And here's a case, anecdotally, I'll admit, of 100%, I wouldn't call it a regret rate, but 100% desist rate of people starting non-binary or trans, and then by their senior year, they're not. And the reverse is true. There's, well, no, that's not true. There's been a couple who have gone from heterosexual to homosexual. And you tend to see this a lot in the arts, this type of movement back and forth. So this is what parents are scared of. Being a trans kid is not a good thing if you have dysphoria, because dysphoria is not a good thing. And so this is what parents are scared of. And legitimately so. I don't think this is an irrational fear. You do not want your child to have dysphoria. It's bad, bad, bad.
Yeah, you wouldn't want them to be dysphoric. You don't want them to
Right.
suffer.
Right. And or be confused or and here's another piece of anecdotal evidence that you can take with a huge grain of salt. I have noticed amongst my peer group who are married with kids, if there's a divorce, and I've seen a few divorces in the last 4 years, within a short period of time, those children will struggle with their identity.
Okay.
That and I bet you if anybody watches this replay later and think I can name a couple cases too, like people listening right now. If here's anecdotal evidence that another reason why parents are fearful is because they see this and they see that how vulnerable kids are when they're in situations that are like other things, stressful things in their life. They can be manipulated into thinking things that will cause more confusion in their life. And this is why parents are scared. This is why parents don't want any talk about gender identity and non-binary stuff, because what you're doing is you're infusing ideas into their head to maybe vulnerable kids who can even become more confused and struggle even more.
They're going to hear about these experiences from people in the LGBT community anyway. They don't need a trans activist to show up like a kind of like rhetorical dementor and confuse them. If it's the case that some kids are having a tough time with their parents splitting up and they're questioning all sorts of things, I don't know why that would be a problem. The idea that you've got kids starting out at a particular point in school and they're saying like they identify somewhere in LGBTQ, and then by the time they're done they don't, or they're maybe bi or they're straight or whatever. Also, I don't think that matters. You question your sexual. You're talking about pubescent kids. We're going through a lot of changes. They're going to have a lot of questions about them, and they're going to have those questions
and confusion.
Well, yeah, sure, but I don't recall a time when I was in that age range between 13 and 18 not being confused about sex issues. Instead of it having to do with LGBTQ issues, it was whether or not I was going to hell because I was horny all the time. And I had these thoughts, but I was a very literal minded Christian in my teens. So it just seems to me that the confusion part that is being imposed on this group, like, well, this is an ideology that's out there, and it's not, but it's an ideology that gets into your kids' heads and makes them confused and scared, and they're confused and scared anyway. They're pubescent kids. The fact that religion does the exact same thing to kids, and I personally experienced that, so that's my anecdotal evidence, is just considered part of growing up. So why would, just because kids at 14 or 15 say that they're LGBTQ, or they identify somewhere in there, and then by the time they're 18 or 19 say they're straight, that's part of them exploring their gender and their sexual identity,
Right.
orientation.
Right. But here's the thing. The thing is, would you agree that it would have been a bad idea for them to transition in the, let's say, freshman or sophomore year? Give those 14 I talked about.
Those 14?
Yeah.
Were they all identifying as trans?
Trans or non-binary?
Trans or okay, well, if they're non-binary, that would probably not be a good idea. But if they're non-binary, they may not be dysphoric. If they're trans and they're experiencing issues of dysphoria, I don't think that we've talked about this before. I don't think that the recommended course of treatment is to just hit them with hormones. I think that is a
Right.
mischaracterization of the treatment. They would go and get therapy, and they'd sort it out first. And then if it starts.
But in hindsight, if all 14 are now what the queer community calls cis,
did a doctor jump in and say, give those kids hormones and surgeries stat? Is that what your concern is?
I don't know their personal lives, but I'm asking this hypothetical question in hindsight. If they would have gone to a therapist and started the process of transitioning, let's say in late grade 9, early grade 10, in there somewhere, would you view that as a mistake, given that now they're all cis?
How many of those kids ended up going to therapy and then through that work realized they were cis and het?
I don't know, but can you answer my question? My question is, given that we know
that it would not be a mistake for them to seek therapy for that. If you're talking about, hey, we got 14 kids here just identified on the non-binary T thing, helicopter in some doctors and give them some hormone treatment and some gender reassignment surgeries, I would think that would be insane. That's not what's going on.
Okay, so that would be a mistake.
Right, because that's absurd. Do you think that that's happening anywhere?
To think it's zero, it would be irrational.
So if some kid at the age of 14 or 15 just says, you know what, I identify as non-binary, then there's a doctor or a professional with the ability to do this, pushing them to do hormone transition, hormone replacement, and gender reassignment.
Maybe not non-binary, but trans. To say that never happens, I think is irrational.
Who's pushing them? Why would they do that?
Money. Ideology. Feel sorry for ism.
What ideology? What? The ideology of a doctor is going to hopefully first do no harm, right? So you don't want to jump to the treatment that's going to be the most invasive, which would be surgery, or the second most invasive one, which would be hormone replacement. You're going to want the therapy.
Are you saying that would never ever happen?
I don't know that it would never. If it did happen, that doctor, any medical professional that's just going to do that is probably going to be looking at as some kind of malpractice and licensure loss.
Yeah,
right.
And I think we're going to see that over the next few years. We're going to see some litigation. But the point I'm making is that if you leave the kids alone, a lot of them sort these things out on their own. If now they go into, let's say, a office where they kind of respect the therapist because, hey, they're their therapist. Oh, they're a psychologist, whatever. And they kind of, I do think kids can be manipulated or taken down a road that, if left alone in 4 years, they're cis. Do you think that's impossible?
What you're presupposing is that if they're just well, you can get multiple conclusions, right? You could just leave them alone and they just maintain a level of confusion for the rest of their lives. We've seen people like that. You've seen unhappy, confused, repressed people that never reconciled their sexual orientation or their gender. If you're talking about, this is where I think this is key, because when you initially started this, you got these 14 kids and they're going to go through some kind of they're going to begin gender reassignment, right? For a lot of activists out there that are terrified of the trans issues in general, they seem to think, for whatever reason, or they seem to conflate the therapy part with the gender reassignment surgery. Like it's all part and parcel of the same thing. If they put their kid in therapy, the shrink's job is to talk them into hormone therapy and gender reassignment.
Yeah, and I'm not saying that. I'm not saying that that's even close to the majority of the time.
But the problem, that's you. The problem is the narrative out there from sort of this anti-trans activism is doing a lot, because they're not being specific about what they mean by this. They're just kind of conflating it, like, and you've said this before. I don't want any of this stuff being discussed in schools. Well, you probably ought to discuss it in schools, because whether or not there are,
I said at the elementary level. At
the elementary, right? Yeah. But it's only a hop, skip, and a jump before you're probably not going to talk about it even in high school. Why would, if there is even the specter of a teacher who's going to be held up to the possibility that you're talking about, a manipulative ideologue who wants to make as many people as trans as possible, manipulating the confusion and the insecurity of young kids. Mm-hmm. If that's a specter that's out there, what teacher is going to assume the position of trying to teach that subject, even at a high school level, if they can be held to some kind of strange legal standard, right? Why would they then assume that? So I don't want to be, they wouldn't want, I'm not going to be some boogeyman that gets attacked by a bunch of Christian fundamentalists because they think that if I'm doing a sex ed class, they think that I'm there to convince their kids that they need to go get operated on, right? And there are activists out there that are trying to accuse sex ed teachers of doing precisely that.
If I got my son to go talk to these 14 individuals and he told me they all went to therapy and the therapist basically help them realize they're cis, would you consider that deconversion therapy?
It's part of conversion therapy, yeah, right? Because they're questioning their gender identity, right? What they're looking for, right? What you're doing, you're giving gender affirming care. If they're confused and they're questioning, and they go to a therapist, and over the course of a year to 2 years of therapy, they reach the conclusion, they reconcile that they're straight and they're heterosexual. That is gender affirming care.
Oh, right. Now, but would you consider that as a deconversion from trans to not trans, like a therapist deconverting a trans person?
No, it's just gender affirming care. They're trying
because they identified as trans, the freshman high schooler, and then they go to therapy, and at the end of therapy, they're no longer trans. They've been deconverted through therapy.
I think that you're almost trying to conflate this therapy process with conversion in like a religious sense. It's still gender. You'd once given me the example, I think, of a kid who was insecure about their body, right? I think you'd used your son. Felt he was too skinny, right?
Yeah.
There's kind of a body dysmorphia kind of thing. Too skinny, they think they should be buffer, bigger, whatever. If you have this kind of issue happening with a kid, I mean, the cause of his problem was adolescence, diagnosed, right? That's just adolescence. But the care that would be given to him, right, would be to affirm that, like, your body's going through changes, you're thin now. Once these changes and all this growth starts to slow down and normalize, then you'll see how things are working out. If a kid is questioning their gender or their sexuality, they have questions about this and they're going to talk to a therapist, the idea for the therapist is to really get into understanding what this kid's about. What is it that they're really questioning? If by the end of that, they're affirming that they're cis het, or just het or whatever, whichever one, this is still a kind of gender affirming care for them. They're not being that like they had questions. Maybe they are trans. Maybe they're non-binary.
Yeah, it's gender affirming care to cis.
It's gender affirming care to all.
No, I mean that led them back to cis.
That doesn't, Doug, you don't seem to, have you ever been to therapy?
No, I've been
So
too happy in my life.
That doesn't matter. It doesn't matter if you're happy. Have you ever talked with a psychologist or a psychiatrist about this issue?
I think in my this issue, no. Oh, hang on YouTube, maybe a licensed one. I'm not sure. I don't think they're licensed.
Okay.
But you see the point I'm making. The point I'm making is that
No.
There can be, if therapy is nothing more than helping a kid try to reason through certain types of confusions, I'm all fine with that. But I do think
that's all it is.
Well, and I do think though that there are some bad actors out there.
Do you know any?
Personally, no. But to think that I mean, you would have to be so naive to think that doesn't happen. Because imagine a feel sorry for do-gooder type thinking, oh, you're a freshman in high school and you're trans. Oh, okay. Like it's this whole idea of the therapist could be trans and say, I was just like you, and you can actually, I think therapy for kids in general can be very dangerous because they're so accepting to what the therapist says as a adult figure.
They're not supposed to do that, right? Like that's complaint worthy right there.
Do what? Not supposed to do what?
If they're trying to well, here's the thing, I was confused when I was a 15-year-old kid and my gender conversion straightened me right out. So I think that's exactly what you need. Like that's a shit doctor, right? Well, that kind of personalizing that kind of thing can get them into an enormous amount of professional trouble.
Is gender affirming being a shit doctor as well? Because from my understanding, therapists are not even supposed to affirm.
They're trying to sort out the gender identity of their client. At the end, the
right,
gender,
but they're not supposed to affirm one way or the other, right?
They're not.
Okay, good. Yeah, that's my understanding as well. And so, but
they're not deconverting a trans person into a cis het something, or a trans individual into a cis person. That's not the point.
Okay, so the kids are doing it on their own through talking.
They're confused. Yeah, they could be confused, or they're questioning, or they're undecided. They don't know.
Okay, given kids have this confusion,
do
you think that this confusion can last years and lead them to, let's say, something more permanent, like puberty blockers or replacement hormones, that would be a mistake because of this confusion that lasts, let's say, 2-3 years, but might not last 10 years?
What's the mistake?
The mistake is to go into, let's say, puberty blockers or hormone replacement therapy because of, let's say, a long-lasting confusion that lasted, say, 2-3 years. But if they wouldn't have done it, these more aggressive techniques, that in 10 years they would be back to cis.
Are they getting therapy? Are they working this out?
Yeah. Let's say within therapy, the doctor works with them for 2 years, and they still have this confusion. I feel like I'm born in the wrong body, whatever that means. And then they take hormone replacement or they take puberty blockers. And then let's say we had a crystal or a time machine, and we could say, okay, if they wouldn't have done that 10 years from now, they would be cis. Could we look back and say that was a mistake to take puberty blockers in HRT?
If that person regrets it, do they regret that? I mean, this is getting into the rate of regret, right?
No, it's not about regret. This is the time machine hypothetical where
why would it be, if it's not a regret for the individual, why would it be a mistake?
Why would it be a mistake? Because they would have gone into being cis just as a matter of time. So
Then they would.
there would be nothing to
follows they would
regret because they didn't do it in the first place, is what I'm saying.
No, but it seems like the opposite would be the case. Then they went and had this procedure done, right?
Right.
And then somewhere along the line, they realized, well, are you trying to say that, well, they were confused at one point in time. They had the hormonal replacement therapy, and then they had the surgery because they're also dysmorphic, or they're dysphoric. They go through these steps, and now what we could do on another timeline, if we'd left that person alone, 10 years later, they just would have been cis.
Yeah, and I'm saying looking back in hindsight,
That's not.
we could say that was a mistake, right?
There's no way to evaluate that. The only way that you would be
I know
able to
it's a
evaluate,
hypothetical thought experiment.
I don't think that it would be a mistake. No, is the person satisfied with their sex change regardless?
Let's say they are. Would you say that's not a mistake?
I would say that would be the indicator, right? If you've got a person who's miserable for 10 years and then reconciles with the fact that they're straight, versus somebody who gets this procedure, spends the rest of their life not regretting that decision, what mistake was made on either side? Mistake doesn't have anything to do with it, right? It was just their life choice.
Well, yeah.
And a lot of that's dependent upon their circumstances too. Did they have access to therapy?
But you ended up doing something that was not needed to be done, and it increases risk of other health problems.
So
not
wearing sunblock exposes you to other health problems. Smoking cigarettes, drinking bourbon, too much bacon, all those things have those kinds of consequences. I'm not exactly sure why. Like, if the patient doesn't have a regret, why would it? Like, who is it a mistake for? What policy for the providers? I'm not seeing where the context of a mistake is here. Sounds like the person's satisfied one way or the other.
The context of the mistake is that they put themselves in higher risk. And I hear what you're saying. You're saying, well, of, let's say, osteoporosis or some other, or sterilization or some other things. So, but you're saying if they're happy with being sterile, if they're happy with having weaker bones, then there's no problem. That's what you're saying.
No. I would be questioning whether or not the risk of osteoporosis and the risk of sterilization are even there, right? Like, why are you bringing that
completely different? That's a completely different topic. But
so let's say that they are aware of that these are legitimate risks, and the doctors lay this stuff out, and they're saying, in another 40, 50 years, you might be looking at X. Do you still want to do this? And they say yes, because they're dysphoric and they want to go through with it, and they do. And they live the rest of their life comfortable, confident, secure with that decision. Where's the mistake?
Well, in my hypothetical, the mistake was that they weren't truly trans to begin with. And so now you've done something.
Who are you to say that they were truly trans?
Because in hindsight, that if, let's say, 10 years go by, they don't identify as trans anymore.
Yeah.
Well, hang on. Maybe there's maybe a disconnect when someone says they're trans. Are they truly trans?
Right. That's what it depends on them, right? It's going to be based on their, not only their self-identification, but how they
so is trans fluid? Is that such a thing?
It is a little bit. Otherwise, you wouldn't have this kind of stuff in the spectrum, right? Like non-binary.
So if someone tells me they're trans, next year they might not be, and then the year after they may be again.
It depends on where they're at. It could be. It depends. Yeah, if they're trying to identify as something and they're working through some stuff. I mean, just like the kids that you were talking about in school. Your son's school. At 15 years old, a kid is saying, like, well, I think I might be bi. I think I might be non-binary. I think I'm trans. And then a few years go by. Maybe they get some therapy. They're like, no, I'm not. It turns out I'm just bi, or I'm heterosexual, or I'm actually trans. But still straight. It could be any number one of those. It could be any of those combinations, right? It's
so if someone tells me they're trans, I can just say, well, for now.
No, it doesn't. That's irrelevant. Well, they could say the same thing to you. Like, do you identify as being cishet? Only for now. You're only heterosexual for now. You're only cis for now.
That's what I'm getting at. Like, I believe that I'm hetero. Like, there's a spectrum of proclivities, I guess. But do you view trans as a spectrum as well? Like, you're kind of trans, sort of trans, fully trans?
That's the reason why you have things like non-binary, you have trans, you have people who are dysphoric, who are experiencing real, emotional or mental anguish about the disconnect between what they feel they are, what they think they are, and how they see themselves, and how they're treated by society. So there are differences there. But so if somebody were to come up to you and you said, "Oh no, I'm just a cishet white guy," cishet for now.
Given that distribution curve of let's say 100% trans, and when it comes to doing more aggressive transition techniques, I think it would behoove every therapist to say, well, maybe wait 10 years before you do something.
They might.
Yeah, and I would applaud that therapist.
But they're also, if you're going into therapy for 2 years, they're already being told to wait. That's happening now. The other thing would be the helicoptered in emergency surgeons that take those 15 LGBTQ kids and start hacking into them and start pumping them full of hormones, right? Which is not real. That is a deranged narrative. That's not happening.
What's not real?
The fact that if a kid at 15, this is the thought experiment I gave you. If the 14 kids that identified at the age of 15, 14, 15, whatever, said that they were somewhere in the LGBTQ thing, they identified as that. Let's say out of the 14 of them were all trans, that immediately what we need to do is get hormones into them and get surgery. Health providers are not going to go to those.
How about after 2 years, does that happen?
It might. It depends on the therapy that they get.
Right. Yes. Have you?
Right. It depends on their situation. It depends on their health.
Have you heard of personal testimonies of people going in for, let's say, 3 visits and then also get a prescription after the 3rd visit for certain drugs to block puberty?
Yes, I think they have. Yeah.
Yeah. Okay. So it does happen, right? And you would say that's not good, right?
Those are reversible drugs. You're just just staving off.
So you're okay with a short duration of prescriptions as long as it's reversible.
Those drugs always have. Those drugs were used for have been used for kids with.
I know. They're reversible if you take them short time.
So what? Yeah. Why would they're like puberty blockers?
But remember the reason they're given the prescription. The reason is because they're trans and they're struggling. But I'm saying, have you heard of these testimonials of people getting access to these drugs with under a short, within a short time frame? 3rd visit, 4th visit.
I have never heard.
A year.
I have never heard a testimony from someone who got that care. I've only heard stories from people who are anti-trans activists say that.
Okay, I encourage you to watch some detransition type videos where people, and you can say they're all lying. Okay, but I have listened to some of them too, and they could be lying, but I've heard some people say, "Oh, after the 2nd visit, I got a prescription." To me, that sounds like a lawsuit waiting to happen.
Why would that be a lawsuit for puberty blockers, right?
Because it's yeah, I think so. I think it was puberty blockers. Could have been HRT, but
that's not they're not undergoing. That's not equivalent to them undergoing a surgery or even hormonal.
I understand, but you're okay
why do you
with
have a problem?
What? Because it is a unwise. It's like going to the doctor and for having the flu or something, and getting prescribed antibiotics when antibiotics would not help the person. It's just like
the reason that people get the problem with that. People get prescribed antibiotics if they have a viral infection because it's used to prevent the secondary bacterial infection that often follows, especially with the flu. The abuse usually happens that people take a couple of them, feel better, stop taking them, then the bacterial infection.
As long as the drug is reversible, you would say it's okay. Let's say a young kid, 15 years old, says, "I'm trans. I'm struggling with my identity." Goes to see a therapist. After session 2, they get prescribed puberty blockers. You're okay with that?
I don't think they can be prescribed puberty blockers at 15.
If that happened, would you be okay with that?
I would be okay with the puberty blockers at pretty much any age, right? Like
if they got prescribed puberty blockers after 2 visits, would you be okay with that? Lean yes, lean no.
It depends on the provider. I would
lean yes. See, we are worlds apart.
I don't think you understand what the drug does. Why are you concerned about the effect of that drug? It's reversible. What difference does it make? Hang on. Do you think that if the kid is getting the drug, they are now more susceptible to permanently remaining trans?
I do think it has
part, this is
effect on.
part of the this is part of the voodoo.
I
That they're
do
using
think that it has effect on their body, whether it's permanent or reversible.
of course,
I'll even give you that.
no,
But
that's not what I'm saying. I'm not talking about the effect it has on their body.
even if you think it has
on
zero effect, at least you could say it's a waste of money.
It's not a waste of money if you're dealing with, specifically if you're dealing with a kid who's going through a lot of dysphoria. If they start going through puberty, the dysphoria.
But you don't know that after 2 visits, do you?
You might. I don't know what the guidelines are for therapy and for treatment on that, but it could be. You could be dealing with a really distressed kid, and so and putting them on a regimen of that to prevent the puberty from happening while they get therapy might be that is probably the best course of action to keep them from losing their shit. And then as they get calmed down, maybe they get off that, the puberty blockers are removed, and the body's back to doing the puberty thing.
Like I don't
understand the concern here.
Yeah, it's obvious you don't understand the concern, and part of the reason is probably because you don't have kids, but or do you?
Well, no, I have a lot of young nephews and nieces, and if they're going through this, my concern would be that they're getting the best care, not to be like, oh, well, the doc put you on a puberty blocker. Well, it's too late now. You've just been cucked into permanent feel sorry for-ism liberalism, right? Or something like that. Like, I don't understand what's going on with the puberty blockers. That's a different issue than somebody getting transition.
Why do you think
completely transitioning?
Why do you think Norway, Sweden, and a lot of other European places that were the forefront of gender affirming care with things like puberty blockers and HRT, why do you think they're scaling back and reversing some of their protocols? First of all, have you heard that?
Yeah, I've heard that. I don't know what the actual numbers are on that, but I had heard that at least one Scandinavian country was kind of reversing course but it was never clear to me with the way it was getting reported if what they were trying to reverse was actual gender reassignment surgery, or if that included rolling back whether or not they were going to prescribe puberty blockers.
It was mostly puberty blockers.
That's what they were.
Yeah. And I agree, the bottom surgery, well, it's not, I don't think it's zero, but I think that's not the real issue here. We're talking about puberty blockers and other drugs. They're rolling it back. They're having questions. They're saying that we don't have enough data and we don't know enough, and so we ought not prescribe these things to kids as a general protocol. Maybe you can come up with exceptions in very severe cases, but for the reason of just being gender dysphoric, no, we shouldn't. So this is my paraphrasing of these studies or these proclamations from these European countries, and I think it's happening now in the U.S. too, and will continue. I actually think the trans issue is basically done at this point. I think 70% of the American population do not want trans women in women's sports. I think when it comes to these the drug issues, more and more people are waking up that for kids, this is a bad idea. Adults, go for it. And so I actually think this is a non-issue. So even if you disagree with me on this, I don't think it matters. It's you have the task of trying to convince the majority of Americans at this point. I don't think I need to convince anyone.